Are now on, I believe. So I want to call to order this meeting of the Bristol, Tennessee City Council. I want to first off welcome council members who are here. Usually we get to greet each other up front at Slater before we start. So we're trying to greet each other a little bit online. So I greet my fellow council people, and then also want to welcome any public who are joining us online. I want to thank our IT department and public relations, community relations for helping us be able to do that at this meeting, and also want to ask anybody who's watching, as well as those of us right here looking at each other on our screens, to be patient. This is our first time to do this. I'm sure we will be perfecting it, but we greatly appreciate everybody working together to make this happen. So I think the first thing we have that's regular on our agenda, Tara, is roll call.
Okay. Kane?
Here.
Powers?
Here.
Luttrell?
Here.
Turner?
Here.
And Fireoff?
Here. Thanks for everybody being here. Bill Sora, I think you were going to introduce any other staff and talk about changes in the agenda.
Yes, the staff members that we have online, Tara Music, our city recorder, as well as Danielle Smith, our city attorney. John Luttrell, I believe, is also listening in to the conversation. What I do want to talk briefly about, we will have either Miss Jamie Swift or Miss Kathy Snodgrass with Ballot Health joining us at 4:40, and at that time I'd like to suggest that we allow her to speak to the governing body, give you an opportunity certainly for questions from her, and then once that conversation has concluded, we'll resume our agenda in its logical order.
Thank you very much. And I think that's quite appropriate, and we'll accommodate her schedule. Next, we have our city attorney, Danielle Smith, who's going to talk to us about what we need to do to legally hold this meeting and any future ones.
Thank you, Mayor. Can you all hear me?
Yes?
Yes.
Okay. To be clear, this meeting is being conducted electronically pursuant to an executive order issued by the governor last week. The video and audio of this meeting is being live broadcast. That's in compliance with that executive order. So members of the public and the media can observe this meeting in real time. In the guidance that was issued in connection with this executive order, the Comptroller's Office recommended that members of the governing body who are participating by electronic means make a finding at the beginning of the meeting that it's necessary to protect public health, safety, and welfare in light of the coronavirus to conduct this meeting electronically. So at this time, it would be appropriate for a member of the governing body to make a motion that council find that this electronic meeting mechanism is necessary to protect public health, safety, or welfare in light of coronavirus. And then if there's a second, then you can discuss that need, and then you can vote that such a finding is that you've made such a finding. If nobody makes a motion, if there's no second, then you guys may not really think that this is an electronic meeting that's necessary, and so we'd have to adjourn and go to a public meeting space. Does anybody have?
Make a motion that we embrace the electronic meeting format in light of the coronavirus.
Second.
All right, so we have a motion and a second. Is there any discussion? Hearing none, roll call, Tara.
Okay. King?
Yes.
Powers?
Yes.
Luttrell?
Yes.
Turner?
Yes.
Fireoff?
Yes. Thank you very
Thank you.
much. And I think next, Mr. Sora, we have our representative from Ballot here.
Yes. I would turn the floor over to her, Mayor.
All right, if you can, we see your name is Jamie Swift, but we heard that it's somebody else coming.
No, I'm Jamie. So I'm Jamie, and I'm the Director of Infection Prevention.
Great. Welcome. We welcome you and appreciate your taking time with busy schedules.
Thank you. And thanks for having me. I had talked to Andy, and so I've got a couple of points that I think y'all were interested in, and then certainly we can take any questions. So Ballard's response so far, so we stood up our Corporate Emergency Operations Center about 2 weeks ago. We have been operating 7 days a week within NCDOC since then. And really that's guiding our system response. So we are looking at, making sure that we try to have as much standardization as possible across the system in our response to COVID and how we're going to manage those patients within our hospital. So right now, I believe the counts that are out right now, Tennessee is at 23 cases, Virginia is at 4 within our region, so that's obviously within our region. Of the 23 in Tennessee, 11 of those have come through Ballad. Most of those have come through our drive-through testing sites. And just one of our emphasis that we tried to share today was of those 11 that have come through Ballad, 8 are under the age of 40. So, we're really still trying to focus on social distancing, really changing that message to physical distancing. So there's some data from World Health Organization that people hear social distancing and choose to completely isolate. So really physical distancing reminds them that they can still go outside, still FaceTime, stay in touch and in contact with society, but just keep that physical distance. I think y'all know we have the Nurse Connect line up, so we have that number. We are increasing staffing there. We're continuing to get lots of calls, so we're increasing our staffing there. We have a good system for testing. I feel like the drive-through system is working since the majority of the positives that we're getting are coming through the drive-through. They talk to a nurse, they talk to a physician, we get those into a drive-through site. So we are increasing our testing capacity. So we are going to continue to, as we increase, refer a few more people in for testing as we're able to. I know you probably heard Alan talk about the Cepheid and that rapid test. So we had hoped and had been told from the company that we would get the assays this week so we could start in-house. As of today, we have still not received that. So right now, all of our testing is still being sent out to either a private lab or to the state lab for our highest risk patients. Turnaround times have been about 7 to 10 days if it goes out to a private lab. State labs are able to turn those around in about 48 to 72 hours. Is kind of what we're looking at. Main points that we continue to focus, and I talked about in the media briefing today, was really the staying at home, the physical distancing, hand hygiene, cleaning surfaces, and that's really just been our message. And I think what we certainly need from any city leaders and government leaders is to continue to try to get that message out. I think that's kind of our brief update, but I certainly can try to answer any questions y'all may have.
Hey, Jamie, can you tell us how many patients right now are in the facilities that are awaiting results on testing? Do you have any idea of what we have right now that you're waiting on the testing to come back?
I don't have a number. Lab is running that. I'm not sure, honestly. I'd hate to hazard a guess. I mean, it varies from day to day, but I can get that.
I was just curious of what was pending, what we have. We've got the positive test results, but of how many are actually pending right now that are in facilities?
All right, and I can tell you most of our pendings, we do not have a lot of suspect COVIDs that are admitted. We have some, but not a lot that are in facilities. We're doing a lot of testing through our outpatient and drive-through testing.
Right.
Okay. Other questions?
I think, I'll say one thing. If you had talked to Andy, we had a call yesterday, and I know there was some, we had asked as far as where we are on ventilators right now, respirators, that of what we have, the 170, that feels like that. I mean, there's more ordered, but we are in pretty good shape as far as that goes.
And I had talked to Andy, and ventilators have been one of those things that we've always you have based on what your current needs are. And we've never certainly needed that many vents. So that has been a normal level of care. Is that enough if we reach full surge with a pandemic? No, and we know that. And so we're certainly trying to get more of those in now that we've reached this phase.
Right.
We've never had all of our vents in use, and so we have a little bit of leeway there, but certainly we'll continue to try to increase how many we have.
Right.
Well, you know, Jamie, I'm Lee Powers. It's good to see you today, and thank you for meeting with us. I think that the public understands that we do have a situation, but I don't think that they really fully grasp the importance of the guidelines that have been put out by the CDC and the president, in that if you can stay at home, you need to stay at home. Yesterday was an aha moment for me. I mean, I knew that we needed to do all of these things, but when it was put in the context of what all has gone on around the country and the number of ventilators we have and the number of ICU beds that we have, is it fair to say to the public, we need for people to practice physical distancing, if not to just stay home? Clean your hands often, cough in your elbow, and clean and disinfect. Because we are waiting, we're trying to keep this thing at as low of an ebb as possible, but we are waiting on additional supplies to come in. And so the longer we can stave that off and keep the curve flattened, the better positioned we'll be. Would that be a fair explanation?
I think so, and I think if you go back and watch the press release today, it's Facebook Live, Alan said a lot of that. We kind of went into him really explaining it's not the fact that we just want you to slow it down so the health system's not overwhelmed. We need you to slow it down so we can continue to prepare, have those ventilators in. So I think he said almost exactly what you've summarized right there. And it's a message we will continue to share. We're doing press briefings every Tuesday and Thursday, so we'll certainly try to continue to loop that into our messaging as we talk to the public.
Well, there's some that they say, oh, well, we don't want to alarm the public with the thought that there are 170 vents. But I think we might get a better response from the public if they really understood where we are with our equipment. And when you talk about supply chain, what is your expectation? What have y'all actually put into motion to build the supply chain?
Yeah, and so Alan was pretty blunt today and actually mentioned, we know we do not have enough ventilators if we go into a full surge. So I hope, and we agree. I mean, we had a very long discussion in SEOC yesterday of, it's not a matter of not scaring people. We need them to understand how concerning and how critical this could be if we don't slow this down and take the messaging into effect and consider it appropriate for everyone. Supply chain, we're constantly working with our partners. We've already we have access to the state cache, as well as we've received some of the strategic national stockpile. So we're working with our regional healthcare coalition, which is for this entire region. It's through Sullivan County Health Department and the Northeast Regional Health Department. So we've secured supplies from them. We've continued to secure supplies from vendors. So, I know Dale is working every single day to just continue to buy and bring in everything that he needs. I think the item that we're shortest on right now is the plastic face shield. And thankfully, that is one item that can easily be made. And as you all probably heard, we have several local industries that are now making those for us. So, if we're going to be low on anything, I'm glad that it's that, so that our partners within the region can step in and it looks like going to be able to fill that gap for us.
So along those lines, I know that there is a response of folks sewing the masks. And can you address the use of the ones that are being provided by the public and who those go to, that they are very helpful? They can't be used in some situations where you have certain criteria for those face masks, but that they can be helpful in other uses.
Yeah, we're extremely thankful for the overwhelming response that we're getting from the community on that. And what we've decided right now is, there's some studies out there that say certainly they do not provide the level of a medical grade mask, but they are better than nothing. And so what we've decided to do right now, and this may change if we reach critical level, But right now, any donated mask that comes in, they will be placed at the registration area, so in ED and various registrations. So up until now, we've always put a medical mask on any patient who presents with respiratory symptoms. As you can imagine, that's a lot of masks that are being used on patients right now. It's extremely important that we mask our patients because that helps prevent spread. And so what we're going to do is take those handmade masks, put those at registrations, and the patients will receive those. They'll receive a baggie that they can keep that in once they're discharged, as well as care instructions. And so they can actually keep that mask, rewash it, have it at home. And we feel like that will really slow down the use of masks on patients and give us a little bit longer to extend that for our actual team members.
Thank you very much. I know a lot of people want to be helpful, and if people are at home and taking care of themselves to self-isolate, et cetera, that's one thing that a lot of people can do, particularly some of our older population, and hopefully some of our sewing is coming back. So hopefully some of our younger population as well can do that. And I assume if we make too many, we can save them.
Well, and we've got on our website, there's the instructions of how to make and the grade that we need. And then we have said, if we are able to slow this down and we don't use all the masks, because we do feel like we're going to get a lot based on our feedback, those will be saved and used for our oncology patients or any immunocompromised. So we are going to make sure they get into the hands of patients.
Awesome. Thank you so much. That is very good.
Well, Chad, yesterday you said you had a question. I've got a few more, but why don't you go ahead, you and Malin?
My question was, if I heard correctly, of the patients who contract the coronavirus, 80% of those, I believe, are not hospitalized or don't require in-depth medical treatment, but about 5% are critical and require the use of the ventilators. My question is on average, and I know it's determined on the health of the patient, age, and many different factors, but on average, how long would a patient stay on a ventilator?
It's hard to say. It does depend on a lot of things. What we're seeing out of Italy and other places is that these patients are on ventilators longer than your typical ICU patient who can be on a vent typically for a few days and come off that. So, there have been cases in Italy that it can be a week or longer that they're going to require mechanical ventilation. And so that goes into the part of flattening that curve and making sure they're all not there at the same time, because when we have extended use, obviously, we don't have nearly as many resources.
Okay.
Lee, did you have, Malin?
Jamie, based on the testing that's been done so far and the number of positives that have come back, what is that percent would you estimate at this time?
I honestly don't know. I can try to get how many. I've not kept up with. We've got someone who's over the lab part of it, and so I'm kind of staying in my lane and letting that section within CEOC manage all the outpatient lab. I know we've done several outpatient labs, and so I can get that and we can send that back through Andy Hall if we can get a total number of tested and total positives. I just honestly don't even hazard a guess of how many outpatient tests have been done.
Sure.
My other question is, do you have the phone number for Nurse Connect? Nurse Connect, do you have that phone number?
Yes, it is 833-822-5523. And what that is 833-8-VALID is an easy way that we've tried to share that.
And then I know y'all are going to be doing drive-through testing, or that's my understanding, at all of your different locations this weekend. When they said all of your locations, what locations would that actually be? Are they going to literally be at all the locations?
It's the sites that have drive-through testing. And so like in Bristol Regional Medical Center has drive-through testing, JMH has drive-through testing. So I know of the hospitals, I know the Med Center does not have drive-through testing. Holston Valley does not have drive-through testing. We tried to keep it away from those larger facilities. Bristol, we had a lot of conversation around, do we use Bristol for a drive-through? And the leadership kind of embraced that just because of their location. And they felt like there was going to be a large gap of the community that did not have easy access. And Bristol felt like within their hospital and using that ED that they were comfortable, even though they were one of our larger facilities that we were trying not to use, if they could manage that. So we have 11 drive-through testing sites, so all 11 will be open starting this weekend. So they're already open, but we'll staff the weekends. We started last week. We really needed to work through the process, and so we did not have them open this past weekend. But from here on out, they should be open 7 days a week.
And so with this type of testing, we do look for the numbers to increase.
We do. We're still going to use some criteria. I mean, it's still really important to make sure we're testing the right people. If you're not having symptoms, there's really no indication for testing. And so that's part of the screening process. We still tell the public, you really need to call Nurse Connect. These drive-throughs are not going to be just drive up and anybody be tested. You have to call Nurse Connect, get a physician's order. We'll tell you where to go and the various process.
And one last question. In regard to the rapid test, the return on the rapid test is what?
We're probably we think we can have results out every 4 to 6 hours. So I know when it first came out, it was 45 minutes. The test itself, once it's set up, takes 45 minutes to run. But you've got to take into account the specimen, getting to the lab prepping the specimen, and getting that result back to the provider. So we think we can run those in a cycle and probably get results out every 4 to 6 hours.
Thank you.
Jamie, I have another question with regards to the blood supply currently. Has that improved?
I have not been involved in that at all. I did hear Alan say in a press conference that it had. I don't know how much, but I think the public has responded pretty well to our call for help.
Good.
Yeah, and I would say we want to support that response and encourage people to continue giving blood as it's going to be more difficult during this time to maintain those supplies.
Absolutely.
So anybody else? I'll just, well, a couple things. Wanted to note, when you referred to Alan, that's Alan Levine. We're talking with the public, who's the CEO. And you also referred to Andy Hall, who's community outreach liaison. What's his title? I forget.
Oh, I don't really know.
He's community and legislative outreach, something along those lines. And we really appreciate his work with us. And I just wanted to point out, and you can confirm, but that there's several things that are very difficult with this, but a couple of things related to testing and then numbers, which we like to see data to know that we're on the right track for decision making. But if you have to have symptoms to be tested, my understanding is you can be contagious for a significant amount of time before you have symptoms, so that you may be spreading your germs prior to that time. Then right now we're waiting anywhere from the 7 to 10 days for a result, or the 48 to 72 hours before someone knows for sure. And I assume they're supposed to self-isolate during that time as much as possible. But anyway, that makes it really difficult to know where we really are in timely fashion, that our data is lagging behind where we might really be. Is that correct?
I think it gives us a good picture. So anyone who is tested is given very clear guidelines on self-isolation, and we've been able to follow up with some of those and feel like that's happening. So certainly from the time they're tested, then they will go into self-isolation until they get those results. And people, I know that's difficult for people on some of those that have gone out to the private lab that seem to be taking a little bit longer, but we've had good compliance with that. There's still a lot of the science out on how much asymptomatic spread impacts the actual spread of this. So certainly it's not, it can't be ruled out. We don't think it's going to be a huge impact, certainly some, but we're hoping that as people start to have symptoms, they call that Nurse Connect, and we can get them triaged appropriately pretty early in their symptomatic process and get them into isolation.
Great. Thank you.
And one last thing, if people are traveling out of town, the health department told us yesterday that as they come back in, they would need to self-quarantine for, is it 10 days or 14 days?
I believe the health department said 14 days, and that's certainly what we're using with our providers and team members. So, you know, that 14 days is certainly key when you've traveled outside the region.
Great.
So, and thank you for that number for the Nurse Connect line. Also, we know our health department is fielding a lot of calls, so letting the public know that health department also, if you're going to travel, you can call the health department. They can help you figure out the best plan for you and your family if you need to do that. They have been very, very helpful as well. So we look to their guidance. All right. Anybody else?
No, I think that's all of
I
that.
think we're going to let you go and appreciate very much
Thank
you
you.
being here. And we look forward to seeing you again at some point.
All right. Thank you.
All right.
Thank you very much.
For joining us. So, all right. Thank you. City Manager Sora, going back to our agenda, I think you were going to just, some of this review we know, but kind of put things in perspective so
Sure.
it helps facilitate our discussion.
Thanks, Mayor, I'll be glad to. First off, I'll begin with the federal assistance and this is working through Congress. The overview that I've seen is this will provide significant benefit to large cities, and I'm talking about cities with a 500,000 population and over. There's very little in there for small and medium-sized cities. One of the things, and I may be modulating here a little bit, but one of the things that we will continue to watch, and Christina Blevins with our staff is monitoring, is perhaps the relaxation of the CDBG funds and how they're utilized, so that perhaps we can use those in ways that current grant restrictions would not permit. In terms of food and shelter and issues like that we'll talk about a little bit later in this presentation. But on the state level, the most significant things that have happened this week from the governor's office is Sunday he issued Executive Order 17, which I'm sure all of you have heard about and familiar with, but this prohibits social gatherings of 10 people or more. It does direct restaurants, bars, and similar food establishments to exclusively offer drive-through or takeout or delivery options. It does allow for the sale of alcohol by takeout or delivery in closed containers, but this must be with a purchase of food. It does direct the closure of gyms, fitness and exercise centers, and similar type facilities for temporary closure. It does restrict visitation to nursing homes, long-term care, and assisted living facilities to essential care only. And then lastly, it encourages business to enact policies that would assist vulnerable populations by considering alternate shopping hours. And I know you've seen a number of our grocery stores and other businesses offer early morning shopping hours for senior citizens. Next, there is a COVID-19 Unified Command Team that's been appointed by the governor. This consists of, it's led by Commissioner Stuart McWhorter. As some of you may recall, he was our Commissioner of Finance. He's taken this role on as a temporary duty and assembled his team. And then on Monday, Governor Lee issued Executive Order 18. When this was designed to further gain efforts in saving personal protective equipment for those most urgent needs. So the executive order prohibited hospitals and surgical outpatient facilities from performing elective surgeries. And these are things like joint replacements or cosmetic surgeries. These types of procedures also ask hospitals that had a surplus of personal protective equipment to donate those to the nearest guard army. This also impacted dental services and the request for saving of PPE at those establishments. Other actions that, from a regulatory sense, child care has become certainly a topic of discussion across the state for critical care providers. That's not only local governments providing essential care, but also certainly hospital workers and the healthcare community in general. There are initiatives to relax regulations to allow churches or other similar type, even homes to gyms even to enter into child care through proper registration, and this can be found at our website in terms of that process. Locally, we're meeting. We have suspended our large management team due to the fact that we were approaching 10 or 12 members of that, and we did this approaching a week ago now. And we divided that team into operations versus admin. And these two teams meet daily. I meet with both teams and chair those meetings. These meetings daily are brainstorming sessions of things that have come up in the previous 24 hours. I certainly share Department of Health information with staff during those times. Also, I'd like to point out that our staff is doing a lot of benchmarking or communicating with peers in sister cities, not only Bristol, Virginia, but also Kingsport and Johnson City, to try to share ideas amongst the chiefs, the public works directors, transit operators, and the city managers are all communicating frequently and generally on a daily basis to compare the operations and assist in sharing information. As you're aware, last week at the end of Friday, all city buildings closed to the public. We are maintaining our operations. A portion of our workforce is telecommuting. 13 of our employees, and this mentioned the quarantine earlier, 13 of our employees who have been quarantined. We use our Department of Health to make this call, and they've all been travel related. They've traveled outside of our community and returned. We have referenced employees who have not traveled, but have had others from our community travel in to visit with them. We've also referred those instances to our Department of Health for their consultation and their advice on quarantines. And we've certainly left that decision to the experts. And currently we do have 13 employees that have been quarantined. They are from various departments across our organizations. As all of our employees that are currently reporting to work, all of them are screened daily as they report to the various job sites, whether that's City Hall, whether that's our police, fire, public works, parks and rec. All of our employees go through a screening. Now, the screening does involve the asking of do you have a difficulty breathing? Do you have a cough? And then their temperature's taken. And these are logged down by supervisors. If you come to City Hall, for example, all employees that work in the annex and City Hall enter City Hall through the atrium, and they are screened at that point before they are allowed to go further into the building. From a public safety standpoint, approximately 2 weeks ago, our central dispatch instituted the infectious disease protocols. And these are questions that our 911 dispatchers will ask based on the type of call that they receive. And certainly some of the questions that I've just asked, but they also try to find additional information if this is an EMS call, such as have they traveled outside of the area? Do they have people visiting with them from outside the area? Have they had these visitors in from outside the area? And based on the responses to these questions, our dispatchers notify our EMS providers or our police response, if that's the type of call that's been received, as to what type of personal protective equipment that they need to employ as they enter the particular building or home or nursing home or whatever the call might be related to. We have transported a small number of patients from an EMS standpoint that had COVID symptoms. None of those have returned back as positive. They all tested out as being the type A flu, which certainly has similar types of symptoms. We do notify the ER if we're transporting from one of our EMS units. As they approach the ER, they communicate the type of patient that's coming in, and they are segregated to a quarantined area within the ER for further treatment and acceptance by the emergency room employees. We'll talk about PD response protocols. We sent out a press release probably a week ago now, or maybe a little bit longer, that talked about our protective equipment and how we will respond, much in the same type of scenario that I talked about, but also in terms of if it's not necessary for our police officers to enter a residence. Now, obviously, sometimes there'll be circumstances that will require that, but if it's not necessary, theft delay, for example, some of those types of calls we'll either do remotely or we'll do from outside the residence. So we're taking those types of cautionary or precautionary measures to protect our employees. In addition, we're doing what's called a 50-50 split within our police department. And what that means is half of our operational personnel, CID personnel, admin personnel are reporting to City Hall, and the other half to the police training facility at Slater Center. And this, once again, just separates those two forces. They are going through, each of them, as I indicated earlier, are going through the appropriate screening before they enter either one of those sites. We have seen a slight uptick on really the same type of calls that we probably seem to see during the Christmas season. In other words, when people are together for a long time in a confined space, we may see more calls for just domestic issues. We have seen a slight uptick in that. Once again, we're benchmarking and sharing responses, ideas with peers across the law enforcement community. Both Bristol, Virginia, as well as certainly Kingsport and Johnson City, and through their Chiefs Association. From a fire standpoint, we were seeing a trend down in EMS calls that reversed somewhat yesterday, and we saw more normal type of calls. But it's been over a week since we've responded to a call that had COVID-19 symptoms. And again, those tests that were performed on those patients that were transferred came back as flu. Our PPE for both police and fire are adequate at the present, both in terms of what we have on our units and as well as what we have in inventory. But the word adequate is that's a tenuous word. You don't know. I think we all feel that we are on the upward climb, and probably in the very low end of the upward climb of this event. We do rely on the Regional Health Coalition for backup caches of both masks and the gowns and proper gloves and so forth. But right now we have adequate supplies to go into the near future. But how prolonged this event lasts will determine inventories. Much like our police, our command staff has dispersed in the fire department. So during a normal operational period, you would see the chief and the two assistant chiefs at the central station. The central chief remains at the central station, along with the shift that's on duty there. Our assistant chiefs have moved to Station 4 and Station 3. Once again, just to separate that command staff. In terms of public works, there's a lot of activity still going on within our community. As many of you have probably seen as you've driven about our community, construction is still moving forward, both of a commercial nature and from a residential nature. So our building officials and our inspectors and our engineering staff are still busy dealing with the types of things that they would deal at any other time of the year. You can communicate with us electronically through permits, through plan submittals, and those type of things. We also have a mailbox at the Shelby Street entrance to the annex for those contractors that just want a hard copy. They want to do a hard copy application for a permit. They want a hard copy the permit back. We meet those needs through that area. Fleet operations will be a critical maintenance operation going forward. We have to have mechanics to keep a police fleet, a solid waste fleet, a fire fleet rolling throughout our critical service delivery. We are continuing to do in-house projects such as storm sewer construction, sidewalk improvements, right-of-way maintenance. You see us mowing in the parks. You see us mowing in the right-of-ways. All these operations continue, but all these employees are also screened at the beginning of the day. Our community development, our planning staff is largely working at home. They're largely telecommuting, but once again, a lot of the things that they do can be communicated electronically to them and still obtain that. Talk just a second about our transit system operations. We have suspended fares, as you all have been made aware. We continue to provide our fixed route, paratransit, and our job access services. These are necessary to meet the needs of the population group that relies on public transportation for access to healthcare and also for shopping, for pharmaceutical needs. We're averaging about 125 riders per day. I know Bristol, Virginia is implementing a van-only service and suspending their fixed routes next week. I don't believe at those numbers we can do that. We do believe that we are limiting the number of riders on the bus, including the driver, to less than 10. We do have a plexiglass screen up on on some of our buses, not all of them, that separate the driver from the passengers, and we're not allowing passengers in the first two rows. That's usually not a problem because we don't have a heavy ridership. As you can see, 125 riders average per day so far this week. That's across our fixed routes, that's across our paratransit buses, and that's across our job access. So I think to suspend our fixed route would overburden our vans for just the on-demand service. I don't think we're there yet. Again, I think you'll see Bristol, Virginia move in that direction next Monday. From a parks and recreation standpoint, all of our parks remain open, and we encourage, as other individuals who have interfaced with this group in the last 2 days have indicated, get out, be healthy, walk, enjoy fresh air, practice social distancing. But our parks are all open for business. Our gate fee at Steel Creek has been suspended now for well over a week. Come out and enjoy our facilities. Like I said, the Nature Center and those type facilities have been closed and remain closed. Our property maintenance crews continue to perform their proper maintenance duty in terms of sanitizing our work areas throughout the day. And this is, there's been much more effort poured into that on a continuous basis by those employees as we've got further into this effort, into this event. Like to our recreation programs, I really want to compliment them along with our BTN staff of coming up with videos, exercise videos, yoga videos. They're planning on doing videos to help parents occupy young children while they're in the child care mode at home. So trying to create those types of opportunities with our current staff. As we get further into this staff, and I'd like to ask Mayor Feierabend to talk about her efforts a little bit later. But as we get further into this, I've asked Terry Napier to serve on a committee that Margaret, I don't know if she's the loose chair of this committee, but she's certainly a major player in a consortium of nonprofits that are pulling resources together to deal with food and shelter needs of the less fortunate in our community. I've asked Terry Napier to also sit in on that community. that community planning effort, and be ready to offer our assistance in terms of staffing resources, in terms of manpower resources, rolling stock, tents. We do have outdoor facilities that can be used in the event we get into food distribution and things in that area. We've looked at locations like the Ira Jones Tennis Court, where we have facilities there with restrooms. That we also have office facilities there that we could use for that type of distribution. So we stand ready from a planning standpoint to work with our nonprofits in partnership to address some of those community needs as we move forward. I'd also like to indicate that Christina Blevins with our CDBG office is participating in those efforts, and she's monitoring very closely what we can do financially with CDBG grant funding. We can use up to, in current regs, pre-COVID-19 times, we could spend up to 15% of our CDBG grant on community programs. And I think, as most of council is aware, and that's round numbers, about $30,000, or just south of $30,000. We do contribute $25,000 of that 30 to the YWCA in support of their daycare program, which is a critical aspect and meets a critical community need day in and day out, aside from the COVID-19 event. So that really leaves us less than $5,000 to commit to other community program. It is my hope that as we get further into this, that there will be guidelines or directives through HUD that will perhaps restrict how we can use some of the balance of that program. It may require some procedural dealings by council to approve a new plan of work and so forth. If that comes, then we can have call meetings and address that. But those two employees, as well as the resources that they bring to bear, will partner with the nonprofits in addressing some of those needs as they develop as we get further into this event. From an administrative standpoint, once again, some of our staff is working by telemetry, but the public can access. Public still needs to do business with us. They want to. There's still property tax payments that can be paid. There's still utility payments that need to be made. There's business license applications, and so all of this can be done remotely. And this is a benefit to our community. But for those who cannot communicate with us remotely, we do have drop-off boxes both in our drive-through and now in our atrium to accept those types of payments. So there are a variety of means to do that. Lastly, I want to talk a little bit about budget preparation. I know we've been in budget mode since before January. I know you all were in a January retreat in which we talked about one type of budget. We talked about a capital improvement program in February. We were going to bring a goals and objectives program in March. We're in a different budget time. And we have to force ourselves to think that way. Revenues, as you've heard me speak a number of times in the last 3 to 4 years, our revenue growth, we have lived on sales tax. Sales tax has been very good to us. I think everyone understands where we are sales tax right now, and no one knows when that's coming back. So I know Tara, I've worked very closely with our budget team to begin to think through what that means to us from a revenue standpoint, what that means to us in terms of what do we have to pay in terms of, we certainly have bonded indebtedness, we have staffing needs, we have operational needs. What are those have to expenditures, and then versus the revenues? And so we'll continue to process that as we move forward. I think at this point I've given a brief overview departmentally and overall organizationally where we are, and I'd like to open it up for questions.
All sounds good to me, Bill.
All right, thank you. I appreciate that.
Anybody else? I had trouble finding my unmute.
Oh, I just think that y'all are doing a great job, and it's important for us and for the public to understand that as we move through this event, things will change, and that our staff and council will be very adaptive and very sensitive to the needs that emerge as we are asked to change. I think great job.
Well, thank you, and that probably is a good segue into have asked staff to go through in the event this event gets more problematic, and I think everybody believes there's going to be a crescendoing of this event. Then what does that look like in terms of staffing? And there will be things that we will discontinue doing, but those essential services will continue to be maintained, and by those I'm talking about. So you're still going to be able to communicate with us on a daily basis. It certainly will be electronically as it is now. Police and fire will need to be here. Water plant operators, utility maintenance personnel will need to be here. Solid waste collection will need to be, especially of that class 1 waste. And by that, I'm talking about the 90-gallon rollout containers. But as we get further into this and we have to reduce our staffing size, then we do have those contingency plans in place to operate at those levels.
Good job.
I had a question. Some of our parks do have bathrooms. At this point, are our bathrooms open, or people need to go prepared to take their walk and go home?
Margaret, I think, and I'm going on an I think now. I believe Terry told me that the bathrooms at Steel Creek were open during the day.
Okay.
But I'm going on recollection now.
Sorry, too.
That's okay. That's okay. Our restrooms at the downtown transit center are open while our buses are there, but then they're secured once they do leave the downtown station. The restrooms at our tennis courts, I don't think, like at Ira Jones, I don't believe are open.
Okay. So if somebody wants to know, they can check in with our Parks and Rec telephone number.
Absolutely.
Find out.
Absolutely.
So, yeah, and I'm glad to hear that our garbage is going to be picked up. And I've said to a few people I know, a lot of folks are going to use this time to do some deep house cleaning, not necessarily with house cleaning chemicals, but cleaning out that closet, cleaning out those spaces. And that some of our places, have not checked, but I assume some of our places are not ready to accept a lot of donations right now because of following some of the rules. Also, some of that waste may not always get picked up immediately. So I think all of us need to be prepared to find that corner to put some of the things that we can then dispose of later. So is that appropriate thinking, Bill?
It is, and I do have an answer to your question. Our staff is always on top of things. I just received a text message from Terry Napier, and he said our restrooms are open in all of our parks. So we're good there. Also, I did, Councilwoman Powers, I did make you aware of a brush fire along the Vance Drive area. I will let you know I've also received a message from Chief Carrier, and the line has been secured around that. So I know you were concerned about that.
Thank you.
Also, while we're speaking of text messages, our Chamber of Commerce CEO, Beth Reinhardt, texted me that Andy Hall is the Senior Vice President of Government and Community Relations, just to give him his proper title. So, okay. So any other questions for Bill at this point? I think the next thing is talking about what are we gonna do for our future meetings. And Mr. Sora, do we still have, and Danielle, do we still have a meeting on our calendar for Tuesday, or did we cancel that?
But it would be, Are you talking about Tuesday, April the, I think, 7th now, I guess?
Oh, that's I think 7th now, I guess?
Oh,
that's a long way away. Okay.
Yeah, yes, it is.
Yeah,
Yes, it is.
that's in this day and age, that's a long way away. Anyway, and I guess part of that would be who would y'all like to be hearing from for updates community wise. We got Ballad today, other health updates on a regular basis, other community updates. What is council's thought on what y'all would like to hear, and then how frequently we should try to do that in a public meeting? I will point out to the public, Mr. Sora updates us daily at this point. In the past, it's been on a as needed with different issues coming in, but because of where we are, for the most part, we're getting a daily update. But so what would y'all like to get updates on?
I would like to have, as far as, I mean, I think with what meetings depending on when your meetings are and when your updates are, Mayor, from during the week, of scheduling around those to where if we have any questions that we would like answered, that we can pass those along, and then that way, then this could be of our way of having those questions answered afterwards, and updates on whatever meetings are going on. And I think that our next meeting, and I know it's not on the agenda today, but it needs to go on the agenda for the next, is, in the times that we're in, we need to think and talk about, as far as the succession plan of, in the event that Bill is not able to do his duties as city manager, of coming up with that plan to put in place.
That I have done that administratively, and that information has been it's in your mailboxes, and we need to figure out how to I guess transport some of that to you all. In the event of my incapacity, Tim Beavers will be the acting city manager. In the event of Tim's incapacity, then Chief Blaine Wade will be the acting city manager.
Well, actually, I mean, not that I disagree with that in any way, but I believe according to our charter, council has to do that in that event.
So why don't we'll get,
let's yield to Danielle on that.
well, or Danielle can check it and we can cover it at our next meeting, whichever. Get Danielle.
Sorry, it takes me a minute to get off of mute. There is a provision in the charter that addresses how city council is supposed to appoint the city manager or the interim city manager. And so I think that if there's an administrative process, then that needs to be something that I look at. And so I can give you that much of an answer right now, but if we can have another answer at the next meeting, that would probably be the best.
Danielle, typically the appointment of the city manager and an interim city manager, interim being defined as if I vacate this position, then there is an interim city manager appointed, much as when Jeff Broughton left the position, I was appointed as the interim. There is a difference between interim and acting.
There is, Bill, and this may be a discussion we should have at the next meeting. If we look at the charter, we'll get some clarity in terms of what they mean by interim. There's a reference in there to illness of the city manager as well as the vacation of the position.
Right. I think that would be good. So, and Danielle usually provide us with a memo and information so we can prep ourselves before discussion, correct?
I can certainly do that. It's, I can send you information on what the charter says on that.
Right. Thank you very much.
Margaret, I was thinking that, and I greatly appreciate all of the updates that Bill has provided for us, but it takes a lot of time. And if we, this meeting today, it's almost 5:30. We've been here about an hour. If we had meetings that didn't really go on too terribly long and they just addressed the issue at hand. We were kept abreast of what the health department is saying, what Ballot is saying. You know, we've learned that teleconferencing is, you know, I think it's pretty cool. And, you know, we get in, we get out, we don't have all the travel time. And especially in this situation, if we could meet just briefly once or twice a week while we're going through this event, you know, I would say to suspend the daily updates unless there was something of an emergent nature. You know, and if you know, if we wanted to schedule someone from Ballot for 15 minutes once a week and someone from the health department once a week to give us the cliff notes, I think that would really be great, and it would be a better use of staff's time, and it would just make for a better process, I think.
So at this point, next Thursday to make it a week, or Tuesday, what's your preference?
When are your meetings that you have with the health department and any
Friday.
other?
It's on Fridays. Friday.
But
So-
if we had someone from the health department to just give us 15 minutes, you know, either way, Monday and Thursday, or I think would be great. And maybe not this Monday, but I think this thing based on our visit with the health department yesterday, they have told us that we have not even begun to wade into the water on this yet. And things are moving fast enough now. I know, Margaret, you've been very involved with the nonprofits. Bill, you've been working very hard to get the operations all together. Sounds like everybody is getting great plans together, so that we'll be ready when this thing really begins to take life. So I'm flexible, whatever y'all want to do, but I think once or twice a week at most, and for them to not be long meetings, and 15 minutes with the health department and 15 minutes with Ballot would be great.
So Danielle, for advertising, is there enough time to do a Monday meeting?
We need to, if you're doing a special called meeting, we need to do 24 hours notice in the paper. And so that should be enough time. If we can get the meeting notice to the paper tomorrow, then it would be published over the weekend, and that should be plenty of time.
So you're talking about a Monday and Thursday meeting. Is that what I'm hearing? Is that the desire?
I'm fine with either just Monday or Monday and Thursday, but I think Monday after the Friday call and kind of see how the weekend goes is, I think that's a good idea.
I think if we, so to save on cost, et cetera, and because there is a lot still to everybody to catch up and know where things are, if we go ahead and say Monday and Thursday, then at our Monday meeting, we can say, do we want the following week on Monday and Thursday?
Sure.
I would think that we would, that beside, and you know, the health department, if it is primarily Dr. May and Gary Mays who are doing the updates, we'll see if there are other people or not who can do that, since they're having to update. And again, we're really lucky. Northeast Tennessee Regional has 7 counties and several cities to catch up with. But anyway, but definitely I would think we could do one or the other, if not both. And the other is to see if United Way, Bristol's Promise could do update, and then see who else would be helpful to know what some of the social service plans are. So,
well, and Margaret, another thought is that having listened to Bristol Promise vis-a-vis the summit, vis-a-vis Ballot's presentation on the new website that's being launched, I know Bristol's Promise has a new website, and y'all all work so integratively together well. We've heard from operations today with Bill. Would it be appropriate to plan on hearing in detail from you Monday?
I think I could contribute, but I think getting Lisa Kofer and Melissa Roberts, if they're available, one or the other of them, would be very beneficial, and then I can chime in. So I think that if they're available to start with, get them to kind of set the stage, and then I can do some updates when they're not available.
Because as we get into this, the word surge has been used quite a bit. I think what y'all have all put together, all of the different entities, it's just, I don't know if everybody's had a chance to look at it. If you haven't yet, you can go to Bristol's Promise to look at, or Margaret can give us the other website. I've written it down. I can't find it right now, for what the Summit Group has done, because as we get into surge and people are having difficulties with food, with clothing, with just whatever their difficulties will be, or our difficulties will be, they have built such an unbelievable website. And Margaret, I know you've had a hand in that, and it's just great. And I think it bears looking at, and so that we understand where to direct people in the process. And it's a lot.
So right now, the helpful websites, you can go to United Way and then go to bristolspromise.org, or go directly to bristolspromise.org. Has a lot, but the website you're talking about is Serving Tri-Cities, and it's going to be better up more completely next week for what we're talking about. So it's still in process. And I would remind us that we want to prepare for the worst, but we're going to work to have it the best scenario possible. So I would hope that and believe that for our area, a surge is not inevitable by any means. Increase in cases, yes, but that's part of the decisions that we make today, tomorrow, next Wednesday, whatever that we do to help that curve to flatten, so that we can be unhappy, being picked up and doing more time at home, and not doing our regular activities, but have less issues with a lot of the different things. So that's what my hope and belief is. So
one thing I want to throw in there, we talk about using all these websites. There's a lot of folks that don't have access to a lot of computers and stuff, and they don't know where to go and search for this ad. So we've got to make sure that we cover that base as well.
Great point.
I think that's a great point, and I think that's one of the things that we're being encouraged to do, is check with our neighbors and people we know, and also to think about people who are vulnerable. Also, some people have some of that savvy but don't have access to internet. So reminding that there are locations, our library is one of those that people talk, you can park in the parking lot and access Wi-Fi. So there are some places where Wi-Fi is accessible. So, but for folks who don't use the internet, we depend on our newspaper, we depend on people calling and checking in and providing information. So I think hopefully we've got a plan to some extent. And we're going to have our city council comments, but Mr. Soar, do you have any city manager? What's our schedule? What's our schedule for everything?
Our schedule is TBD, to be determined. No, I have no further update.
I would think if things settle, but we still are doing some of our online meetings, we may want to look at some of the things that have been on our agenda that would be easy to deal with in these meetings, possibly. And if there's anything we can get done, take it off our agenda so that it moves things forward for folks and for business. I would think we would want to do that, but I don't think we're there yet. So,
well, our next meeting, I think, it's the first Tuesday in April. I think it's April 7th. So we've got a little bit of time to spend in that conversation, especially if we're going to be on our meetings on Monday and Thursday next week. we should be making some decisions at least well, certainly by that Thursday meeting and probably by the Monday meeting as to what we're going to do with our business meeting in April.
Okay, thanks. All right, council comments? Anyone?
I'll start by saying I think the Monday and Thursday meeting, I'm assuming we're talking about 4:30 at the same time is fine. If we do need to be updated individually, Bill can call us and let us know about anything emergency wise. I think good work so far, good information so far. And I agree with the fact that public meetings, but the press conference I felt earlier this week was good, informative information for the public at large. It was carried on TV. I would suspect that there's probably going to be something else coming up from the two entities, Ballard and the health department. I would almost bet there's going to be a press conference or some kind of an update that'll be on TV next week as well. So I think the public in that respect will probably be updated, but I think this week has been a good week for information.
I agree.
Yeah, I agree, Chad. I mean, we cannot afford to not over communicate at this time. You know, there's so much that's changing every day, and I think it's very, very important that we keep this out in front of all the citizens that we have in the area. So over communication is great.
I would just add that, you know, Margaret has referenced Mr. Rogers. Well, I would reference Ernie Rumsfeld, that you go to war, you know, the Army and weapons you have. And our greatest weapon that we have right now in all of this are the people of our community. And the people of our community have got to understand that this is very real, that our resources are what they are and they're not what we will need if this thing does take a surge, and that the best thing that we can all do to protect one another is to stay at home, is to clean our hands often, is to practice physical distancing, cough in your elbow, clean and disinfect. But the staying at home keeps us at the least risk, and it also provides the least risk for everyone else. And so as much as we can, we're not on holiday, the schools are out, they're still in class at home. We need to take this very seriously so that the curve stays flat as long as we possibly can while we get the additional supplies and equipment in, if at all possible.
Thank you, Lee. Vince? Do you have anything?
I think it's, I think I'm good. I think we just, the communication, like Malin said, that we can't have enough right now, and making sure that we are prepared as much as we can to if things change. And let's hope they do not, but let's be prepared if they do. So that's it.
Right. Yeah. So I think the communication is not just us having communication with each other as our government leaders, but it is opportunity for our community to get updated and get a little more in depth than some of the regular outlets can provide. It'll be interesting to get the analytics on how many people have watched. It will be interesting to see when we go back to our regular meetings to see if that those analytics continue, if people feel like it's important to hear what's going on with their local government. So appreciate that. And yes, the most thing we can do is to take care of ourselves, but also take care of others by doing the physical social distancing, by taking the precautions. And also for folks to remember that the numbers are right now still are lagging. The published numbers lag behind the reality. So it's getting to the point where that reality can catch up with where we are, so we get a better picture, and hoping that's happening on several fronts with different opportunities. So anyway, so we want to thank everybody for coming. We thank Jessica Swift for being with us. Thank you, our technology IT folks and community relations and city attorney, city manager. And I guess if nobody else has anything to say, we will all click the button that says leave the meeting after I say that we are adjourned.